Hello, it is Ryan, and we could all use an extra bright spot in our day, couldn't we? Just to make up for things like sitting in traffic, doing the dishes, counting your steps, all the mundane stuff. That is why I'm such a big fan of Chumba Casino. Chumba Casino has all your favorite social casino-style games that you can play for free anytime, anywhere with daily bonuses. That should brighten your day a little. Actually, a lot. So sign up now at ChumbaCasino.com. That's ChumbaCasino.com.
No purchase necessary. VGW Group. Void where prohibited by law. See terms and conditions. 18+.
Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen, and I thank you so much for listening. If you'd like to track me down for comments, questions, anything there, Eric Christensen, PharmD, BCPS, BCGP on LinkedIn. That's probably the social media platform I'm most active on. Or you can catch me at mededucation101 at gmail.com. And of course, I've got to remind you, at reallifepharmacology.com, we've got a free 31-page PDF on the top 200 drugs. So it's a great little study guide where I lay out things that actually happen in clinical practice, as well as things that frequently come up on pharmacology and or board exams. So let's get into the medication I want to discuss today, and that is levetiracetam. Brand name of this medication is Keppra, and it can be used for seizure prophylaxis and management of many different types of seizures in general. Mechanistically, it's not actually really well understood how this medication works. It's suspected it may have inhibitory action on voltage-gated calcium channels in the central nervous system, and this may aid in promoting the action of GABA, which, if you remember what GABA does, it is an inhibitory type neurotransmitter. So that's potentially, again, not totally well understood, but potentially how it could help in managing seizure disorder. Adverse effect profile. Most common thing that I have seen in clinical practice by far is fatigue, potentially dizziness, and then probably less common, you may see some psychiatric changes. So whether that be, agitation or anxiety, things like that. Rare adverse effects, hypersensitivity reaction, skin reaction, hematological effects that are rare, certainly, and then possibly elevation in blood pressure as well. And this might be a little bit more selective for our pediatric population. Dosing of this medication, 500 milligrams twice daily in our older adult population is the usual initial dose. Dose increases, on an outpatient basis, usually every couple of weeks is when we're going to increase that medication up to a max of anywhere from probably 3 to 4 grams per day, or that'd be 3,000 to 4,000 milligrams per day. We do have IV available, as well as both immediate release and extended release oral agents. What is nice about oral immediate release and IV is typically considered to be approximately bioequivalent. So transitioning from IV to the oral agent, we've got a 1-to-1 ratio there because the bioequivalence is approximately the same there. So that makes things easy when we're converting from one to the other there. Now, I did want to mention drug levels, because this is a question that I've been asked many times by students. I've had to look it up myself. I've been asked by different physicians and providers, do I need to monitor routine drug levels? And the answer is no. You typically do not need to monitor routine drug levels with levetiracetam. And the primary reason for that is there's really no correlated target level for efficacy and or safety. And so, just saying a level of 35, is that efficacious or not? We really don't have that evidence to say that it is, or that it's tolerable, or whatever drug level you're dealing with. However, there are certain circumstances where I have seen these drug levels checked, and I would say the major reason is adherence. So if we feel that a patient isn't taking the medication for some reason and they're having seizures, that's a situation where we just might want to check and ensure that they do have some drug within their system. Other situations where you may see it checked, drug level checked, pregnancy, potentially renal changes, maybe geriatric patients. But again, if we're just looking at a level, and we don't really have anything to go off of from the past, we don't have any baseline level, it's hard to really assess like if that level's gone up, has it gone down, or where we're at there. So having that baseline level, if we do have a history of that, then potentially getting a level may be advantageous just to see where that patient has been moving. Again, this is probably in situations where the patient's presenting with seizures, or they're presenting with potential adverse effects as well. If a patient's been stable for a long period of time, no seizures, no apparent adverse effects, well, there's really absolutely zero reason to check a level in that type of situation. So I did mention renal impairment as a potential issue with increasing levels and why we might check a level. So as kidney function declines, we can anticipate that we might have a requirement to lower the dose over time as well. So keep that in mind, or at least in that situation of worsening renal impairment, we'd probably want to monitor a little bit more closely for some of those adverse effects, because those drug concentrations may go up as that kidney function declines. Now, I have seen this drug put on board for seizure prophylaxis in traumatic brain injury patients, and that can be a little bit of a tricky situation because I've seen situations where patients have never actually had a seizure because of potential trauma damage to the brain and central nervous system. You may have some providers that want to do seizure prophylaxis, and at what point do we come off of that seizure prophylaxis if things are going okay? That can be a challenging thing to try to determine and decide, and certainly I'm going to lean on clinical experts there to assess whether it's appropriate to come off there. So having neurology involvement and expert involvement, I think, in determining when to come off seizure prophylaxis is really, really important. But I will say, if we're going to potentially try to reduce or taper off any type of seizure medications, we've got to do it slowly. Okay, so there's an increased risk of seizure if we abruptly stop seizure preventing medications. So just start, really go slow if we're tapering off any type of seizure medication. All right, so that's going to wrap up the first section here. Let's finish up on drug interactions when we come back from a break from our sponsor. If you're in the market for pharmacist board certification study material, such as BCPS, ambulatory care, BCMTMS, or BCGP, definitely go check out meded101.com/store. In addition, if you're a healthcare professional looking to brush up on drug interactions, clinical pearls, case studies, we've got numerous books and resources available, some through Audible versions, others through Amazon as well. So again, all those links, meded101.com/store. Your support is greatly appreciated in helping keep this podcast free and educational for all to enjoy. All right, so finishing up on drug interactions. One of the real big advantages of levetiracetam is that it isn't broken down by the CYP enzyme system, or at least that's not its primary way of being deactivated and eliminated in the body. So because of that, we generally don't have to worry quite as much about numerous CYP interactions compared to some of the enzyme inducers, such as phenytoin or carbamazepine and those phenobarbital and those type of older anti-seizure medications. So that is a really, really nice thing. Now, I will say in rare circumstances, and the clinical significance is debated, but some of the enzyme inducers may lower concentrations of levetiracetam. So a drug like carbamazepine, for example. So I think it's important to keep that in mind anyway. And again, I mentioned that I think in the drug level section, that might be a situation where somebody might consider checking a drug level. So again, that clinical significance of that interaction and how much it's going to drop concentrations of levetiracetam if you start a drug like carbamazepine. It is clinically debated and hard to know exactly how much it's going to drop and whether it's clinically significant or not. So the primary adverse effect that I think about in combination and in possible drug interaction is CNS depressant activity. So your alcohol, your opioids, benzodiazepines, older anticholinergics, antihistamines, those type of agents can have additive, sedative type effects, and certainly with levetiracetam on board, that may be a little bit greater increased risk. So that's something I do look out for, certainly. Looking out for increased sedation, maybe dizziness, things of that nature. All right, so I think that's going to wrap up our podcast for today. If you enjoyed the show, found something useful from it, definitely leave us a rating, review on iTunes. Greatly appreciative to those of you who have already done that. Go check out reallifepharmacology.com, snag that free 31-page PDF on the top 200 drugs. And if you want to reach out to me with a message, comment, question, you can do that at LinkedIn, Eric Christensen, PharmD, BCPS, BCGP, or track me down at mededucation101@gmail.com. I'm going to sign off for today. I thank you so much for listening. Hope you enjoyed the podcast, and I hope you have a great rest of your day.
It is Ryan here, and I have a question for you. What do you do when you win? Like, are you a fist pumper, a woohooer, a hand clapper, a high fiver? I kind of like the high five, but if you want to hone in on those winning moves, check out Chumba Casino. At ChumbaCasino.com, choose from hundreds of social casino-style games for your chance to redeem serious cash prizes. There are new game releases weekly, plus free daily bonuses, so don't wait. Start having the most fun ever at ChumbaCasino.com.
No purchase necessary. VGW Group. Void where prohibited by law. See terms and conditions. 18+.